Guys, just a quick note before we get into this episode, just to say that we are still raising money for the children in Bangladesh who are street workers. These children have either been forced to work on the street or they have to do so to provide for their family. We want to give these guys an education. We want to get them off the streets. If you want to support, head over to muslimgiving.org/freshly grounded or click the link in the bio and you can either donate some money towards the project. £300 supports the whole child and staffing for a whole year, or you can join the team by clicking join team and you can fundraise for us. So you can choose to fundraise for £300 and then you can help spread your link across and get your friends and family to donate and help. Okay, cool. Let's get into the episode and the intro actually. Welcome. Oh, I'm on. Now I'm on. Welcome to episode 120 of Freshly Grounded. We've hit, I think that's another milestone. Let's call it a milestone because anytime we can call something a milestone is great. This episode is with Dr. Riz Mahmood. Stay for the intro because I really want to let you guys know about Riz before you guys enter the episode because he is super interesting. Bear in mind, guys, that we are 4.5 weeks away from our live event at the Aldrich Theatre. Freshly Grounded is taking over the Aldrich Theatre. We're live in London. This is our biggest auditorium, biggest theatre, biggest event yet. It's going to be super inspiring. We've got keynote talks. We've got sofa chats with people who are at the top of their fields. We're going to be announcing some more guest speakers soon. Make sure you guys get your tickets at freshlygrounded.com/tickets. We're going to be live in the Aldrich Theatre, like I said, September 22nd. And listen to this. It's actually the first time you guys are going to hear about it. But anyone who buys their tickets during a bank holiday weekend and then basically screenshot it and put it on their story and tag us. I'm going to make a video about it and put it on the Freshly Grounded YouTube channel today. So keep an eye out for it. But basically, we're going to select someone at random and we are giving away a weekend holiday in Morocco, Marrakesh. So definitely grab your tickets this weekend and watch the video on the Freshly Grounded YouTube channel. That's going to be out on Friday, which is today. So that's that. Guys, listen, this episode is brought to you by Holistic Social Care. Holistic Social Care are an alternative to mainstream care providers, because they're offering a Muslim-centered approach to the health and social care needs of the community. This means that these guys, they help adults who have physical and mental learning disabilities, as well as the elderly community, and they ensure that they meet the right to respect and provide dignity to all of their clients. They're going into these houses where needed, and they're coming to people and they're focusing on providing them whatever care they require. But the thing I find the most interesting about Holistic Social Care is that they're Muslim-centered, which means that they understand your faith. One of the scariest things when having a grandparent or a sibling or someone in your family or friend circle who is dealing with mental health battles, one of the tough things is knowing that you want them to be cared for by someone who understands their faith. And that's what these guys do at Holistic Social Care. They're an award-winning national organisation based in Sheffield, Manchester and Birmingham, and their social enterprise organisation means that they're committed to developing the Muslim communities through charity fundraisers and increasing awareness of health and social care rights, as well as offering a voluntary support to the most vulnerable in the community. Their staff and carers are trained to deliver services and care that promote the rights of every individual to be treated with respect and dignity, as I mentioned. Their services include personal care, adult daycare, care and companionship to allow for their service users to keep their independence and dignity, as well as allowing for them to live comfortably within their own home. That's why it's super important, guys. These guys allow your nearest and dearest to live in their own homes, but they bring the care to them, and they have like I said, they have a Muslim catered approach. So I think it's super worth looking into. If you have someone in your family or friend circle who requires that kind of help, check out Holistic Social Care by going to holisticsocialcare.org. Now, guys, listen, this episode is with Dr. Riz Mahmood. I'm super excited for it. Reason is because of this. This guy is an alien. Okay, no, he's not an alien, but he has a degree in medicine and a degree in dentistry and a master's, and he's still carrying on studying, all whilst co-founding one of the most successful dental practices that we have in London. every top influencer is going to these guys, from like sports stars to social media influencers to celebrities to TV stars. And we hear from one of the co-founders of Rüh Dental, as well as that, the kind of podcast is more so focused on his studies and why, and his mentality. As you guys know, I'm super intrigued by people who like social psychology and understanding people's mentality, especially like people who are clearly elite level thinkers. And I think that's what Dr. Riz is. He's an elite level thinker. He has been featured in BBC. He's been kind of all over the shop, and he's about to take part in some training in like one of the best dental schools in the world. I don't think I've done it justice, but a very, very interesting man. We get insight into the mind of a doctor and someone who has studied like crazy. So without any further ado, guys, this is episode 120 of Freshly Grounded.
And welcome to Freshly Grounded, the brand new podcast by best friends Faizu and Sam.
Huh?
I said welcome to Freshly Grounded,
After that bit.
the brand new podcast
And after that bit?
by best friends Faizu and Sam.
Really?
First thing that I want to discuss with you
Yeah, go for it.
is kind of, before we move on to other things, is that people are starting university right now.
Yeah.
And a lot of people are going to be listening to this who have chosen dentistry or medicine. My question to you is, how can you prepare a person who's just about to start? Let's talk about dentistry first, and we'll kind of go on to the other stuff in a second.
Yeah.
But because dentistry is kind of, am I right in saying like your main thing?
Yeah, I mean, to be honest with you, bro, I've done both. So I know both the sort of benefits, drawbacks, advantages, disadvantages, and how both courses work. I personally found dental school a lot harder, because maybe it was because I was 18 at the time, and when I went back to medical school, I was a bit older and a bit more mature, and I knew how to study. But I find that, you know, the struggle that I found was just finding time to study. That was the biggest thing for me first time around. I mean, it was a problem second time around as well, because it was different. I was married, I had kids. But in terms of, you know, just being on point with like exams, trying to sort of have a social life, because look, at the age of 18 I was born and raised in London. I moved to Bristol, like
Wow, that's not too far from Cardiff.
Yeah, exactly. So as you know, it's a completely different environment compared to like somewhere like London, you know, very multicultural metropolitan city. So you want to experience a bit of a social life. So I found trying to balance that was quite difficult as well for me, because, you know, I moved to another city. I've never lived out before. There's a lot of challenges with that, you know, becoming, you know, a man. I think that's what it really did for me. So any advice in terms of I can give any guys going out to do dentistry and medicine is that, you know, try and keep a good friend group around you. That was really important for me. Try and keep close contact with your family at all times. They will always be there for you. That's what I found as well. When times got tough, they're the people that are there for you. So just make sure that you have that available, and just try and stay grounded, really. You know, that's what I'd say.
So I mentioned I will mention in the intro that kind of like the thing that stuck out to me about you when we first met was when you were talking, I've told you this kind of numerous times now, is that when you told me that you've studied medicine and dentistry, because you don't hear that often when someone studied dentistry and medicine. So what led you to dentistry?
Yeah.
And then after dentistry, what made you want to then do another degree in medicine? Because dentistry itself is a 5-year course.
Yeah, dentistry.
And then medicine's another 5 years if you don't do anything extra, right?
Yeah, so basically it's a 3-year. I got into the 3-year accelerated program based on my dental background. But going back to what you're saying about why dentistry, I think the first thing to say is what I wanted to be able to help people, whatever career I got into, actually physically being able to help people. That was important to me. And to be able to, you know, earn a decent amount to sort of support a family, to sort of live a good life. And I think I come from a very humble background, and, you know, we really, you know, my mum and dad did struggle when we were growing up. So, you know, for me, it was to try and be able to afford to live my life as well as be able to support them as I grew up, and throughout their lives as they got older, to be able to help them. And alhamdulillah, I'm glad to be able to do that now. So
just to butt in, you must have the proudest Asian parents ever, because they not only, you know, they say my son's a dentist, my son's a doctor. You're a dentist and doctor. If you now just did an accountancy degree, bro, your parent, you were like, it would go through the roof.
Yeah, well, look, man, I think, you know, it's all down to your parents. You know, your
Yeah.
upbringing, the way you develop, is down to your parents, and I owe a great deal to them for the way they raised me to this and my brother. So, you know, for me, it was about helping people and being able to sustain a good life for me and my family as I grew older, and I had that mindset from a very young age. I got into dentistry. I enjoyed some aspects of it, the academic side of it, the practical side of it. And then I just got exposed to another side, which was the surgical side of things. And that's what really just sparked my interest. You know, I remember being in an operating theatre just as a part of my placement during dental school and seeing these guys reconstruct people with huge cancers of the face and the jaws. And it was like, you know what, this is amazing. This is next level. I'd love to be involved with something like this. You know, that afternoon I went back to a clinic to treat sort of things like gum disease, and it just made me realize there's some really unwell people out there, and you could make a real difference by, you know, training up to be at that level. So to me, at that point, I decided, you know what, I just really enjoyed the surgery, really loved the environment, the vibe, you know, all the surgeons were really nice and friendly, and it just spurred me on to go and want to do medicine. So even during my dental degree, I had the mindset that I'm going to go and study medicine to become a maxillofacial surgeon, because I knew you need to do both degrees to get to that point.
I saw you showed me the other day that documentary that BBC were filming, and in that documentary you can see you like stitching together that head. And, but what is going through your mind when you see a head split open, bro, and you're stitching it back together? And surely it's not a natural human reaction not to be like, oh my gosh, I can't look at that.
Yeah,
You're just so calm, and I think I can see the calm in your personality. Do you think that? Did the calm in your personality come because you had to deal with things like that, or is it because your personality is like that that you're able to deal with those things? Which one is it?
I think, I mean, my calmness actually, it's a strange, weird way. I always saw whatever situation my dad was in, he'd never freak out or stress. He'd just like be chill and calm about it. So I've always been just calm about any situation, even if I have somebody like literally bleeding out in front of me. I've had that on numerous occasions where, you know, someone's been stabbed in the face or someone's been stabbed in the neck, someone's tried to commit suicide and slit their own throat. I've had situations where I've seen patients literally lying there like that in front of me, and it's all about just being calm and remembering the basics and the fundamentals of what you've been taught and trained to do, and just executing that step by step. So going back to what you're saying about that, you know, it stems from that personality, I think, because of my father. And it's just, you know, when you've seen things over and over and over again, it's not that you become immune to it, it's that it becomes normal to you, so you know how to deal and manage the problem. So for me, seeing that in front of me, it was, you know, it was quite a bad situation. She was anesthetized because she was very unwell. You know, she literally, her brain was coming out of that wound. It wasn't the prettiest sight, but to me, I knew I need to help this lady. Let's get this wound closed so that there's less chance of her getting infection. And that's what the first port of call in my mind. I don't see it as, oh my God, I'm freaking out right now. I've not done this before. I've been in many situations where I've treated very unwell people. I've looked after sick cancer patients. I've looked after people that, you know, are advanced trauma injury in A&E. So, you know, I've seen a lot and done a lot of different things. So seeing something like that, it almost becomes a bit normal in a way, which is a bit weird to say, but my training has led me to that point in life where I'm able to say, look, okay, I can pretty much deal with this situation. I know what I'm doing, and, you know, I can manage it.
I think there's something very important about having that characteristic of emotional independence, and it is something that's spoken about in hadith as well, having emotional independence.
Sure.
I think, if I'm not mistaken, Jibreel alayhi salam related to the Prophet sallallahu alaihi wasallam about being independent of certain things, and one of them was I believe emotion. I might have got that wrong, but the point is that there's such an advantage of having that and not having an erratic personality like myself. But do you see having that first? Do you see an advantage in having that type of personality in outside of like dentistry and medicine? And then, secondly, do you ever see like the downfalls of it? Like, are you able to let your hair down and just have a good time, or just because of how much of a serious career and like how on focus you have to be at times?
Yeah.
Can you turn it off?
I mean, it's a good question. I think for me, it's more like, I just take everything as it comes. I'm an easygoing guy in general, and that was my approach in that situation. And I'm quite relaxed about most things in life. I don't get too stressed out about anything. And even if I do, it probably won't show very well, to be honest with you. But I think for me, I do let my hair down when I can. I think, the only time I really do is when I'm with my kids, to be honest with you. That's the sort of time where I'm just relaxed and chilling and messing about with them, playing with them. That it brings a different side out of you, almost a different type of trait and personality characteristic when you have children. I've been blessed, alhamdulillah, with 2 boys. And you're able to let your hair down with them for sure. That's my sort of outlet in a way, I guess. I go home to see them and spend time with them. And I think I never thought I'd be that type of person before children, but I think when you have kids, it just brings a different type of mentality to your life. And I think going back to the initial discussion about why medicine, why dentistry, I came to a crossroads in life where I was like, I had a job starting to do the foundation training to become a maxillofacial surgeon. But at the same point, I had a 1-year-old or 2-year-old and a newborn at the same time. And Zeba was also running 2 dental practices at the same time. So I had to make a decision at that point, what was the right thing to do. And it was a tough choice because surgery, medicine, that was my passion. That's what I thoroughly, truly enjoyed. But at the same time, I had that sort of clash to say, well, what's more important, your family, your children, the dental practices that your wife has, had a vision and dream of building. And it was a really tough time. Like, I was torn between the two because I'd invested so much time and effort from being a dental student back in like 2003 till 2015, a good 7-8 years of my career just spent as, focusing on doing maxillofacial surgery. I'd written publications, done papers. I spent a lot of time and effort going to do presentations internationally just to get to that point. And at that point, it was just kind of a decision I had to make. So for me, I had to sort of choose that at the time. And alhamdulillah, things happened for a reason, because I took time out and focused on the dental practice. I went to do dental implants and I began to enjoy that. So then after I'd done the dental implants, I began to understand dentistry to a whole new level, which I didn't really enjoy at dental school, and I didn't really enjoy when I did my foundation dental training. So it's just opened a whole new world for me in terms of what I can potentially do and enjoy. And, we work, alhamdulillah, with a great team we have, from the clinical staff, from, the support staff, from people like yourself and Omar. It's great to be able to work with so many different people, whereas I didn't really understand that was available to me when I was doing my foundation dental training. It was just a standard run-of-the-mill NHS dental practice, which is absolutely fine, but that didn't really inspire me or excite me. But this is a whole new different concept that we've kind of developed now at this point in time.
You mentioned Zeba. Has she always been like supportive of anything that you've wanted to do, kind of, because you mentioned that you went into medicine as a married man?
Yeah.
And so that must have been tough on her,
Yeah.
knowing that you're about to enter like a 3-year degree for like one of the toughest degrees.
Yeah, definitely. I mean, to be honest with you, the moment we first started speaking, I laid it all out for her and said, look, this is what I want to do. And she was supportive and has always been supportive of my decisions, irrespective of what impact that may have on us, sort of personally, financially, etc. So for me, I always had her backing, and that I'm truly grateful for. We work together, we're a team. That's the way I look at it, as a couple that we are, as we're married. And she's always inspired me. I've not met anyone like her who's got this sort of dogged vision of what she wants to achieve in life and be a entrepreneur and empower women in business and dentistry. She's very hardworking. She's a mother to 2 children. She's a wife. She does a lot. So I've got a tremendous amount of respect, as any husband would. But it is amazing what she actually can achieve and what she's done at this point in her age.
How do you even start to show someone like that appreciation, knowing that they're balancing being a mother, being a wife, being a daughter, running one of the most successful dentistry clinics, or like in London, like in the centre of London.
Yeah, I don't know
How
about
do
that, but yeah.
Well, you guys have a clinic in obviously Fleet Street and a clinic in Notting Hill. And congratulations on Manchester store. Is that open now?
It's opening in the
What
next.
do you call it? Store sounds wrong. Clinic.
We call it a clinical
Okay,
practice.
okay.
Practice, yeah. So yeah, that's going to be opening in the next few weeks as well. We're looking to open in November, December time.
So how do you relay your like? Because I feel the same with my wife in that it feels like women have a superpower.
Yeah,
in that they can handle a lot and not break down.
Yeah.
But although you obviously can as well, studying the different things that you studied as well as doing the masters, but it feels like the women in our lives are able to handle everything at once and in different like spaces. Like it's not just education, it's not just work, it's everything. How much of your like the success of, and when I say success, I don't mean financial, I mean success in terms of like getting through day to day and being happy at the end of like the day and feeling like you've accomplished things. How much of that success do you relay back to the fact that you are in a marriage with someone who is very supportive of you and is also kind of managing everything on their end?
I mean, for me, like, we push each other. I think that's the biggest thing. I'm always like wanting to push and do bigger and better things, and we've always got that mentality, and we just end up pushing each other, and I think that's what eggs us on. And I think when you say success, you can measure success in so many different ways, and so I don't see myself as successful just yet. I still think, for me personally, we've got a long way to go before I would just classify myself as successful. And some other people say, oh, you're being a bit hard on yourself, but that's just the way I am. I am hard on myself, and that's the way I see to improve and strive to get better in whatever you do. That's my mentality and approach.
Being in a Pakistani background, what do you say to people who might be in a similar boat to you, but they say, I want to study and settle myself before getting married?
Yeah.
Because you didn't do it that way.
See, yeah, that was always my plan, actually, to finish medicine.
So do you regret not doing it that way?
No, because alhamdulillah, I'm in such a blessed situation now. You know, I've got a beautiful family, and that to me is the biggest thing for me to be happy with. My parents are healthy, you know, and for me, it's all about, you can always regret decisions, but there's always a bigger plan in mind. We were discussing this earlier. There's always a plan. You know, sometimes you try and, you know, change that plan, but the plan has always been written for you. So for me, when I look back at it, I'm about to embark on a 4-year training program. Now I'm still training. You see what I mean? So I'm still going. I'm doing a specialist training in prosthodontics at one of the best universities in the UK and even the world, some would argue. So for me, I just keep going, and that's just my mentality. But, you know, that's the way I'm wired, I guess. And in terms of a plan, in terms of regretting decisions, if I didn't do what I did, if I didn't do dentistry, if I didn't do medicine, if I didn't struggle and strive, see all the craziest stuff in A&E that I'd seen, it wouldn't have made me credible enough to get onto this training program. Do you get what I mean? Because this is very competitive. There's only 4 spaces available, and you get a lot of applicants. So if I hadn't achieved all those, alhamdulillah, all these accolades and achieved all this experience, if I hadn't studied dentistry, if I hadn't studied medicine, if I hadn't done a master's, if I hadn't published all this work that I've done, if I hadn't, you know, done all these things, then I don't think I'd be credible enough to say, yes, we'd accept you onto this program to do this prosthodontics training. So for me, there's no regret, because there's a plan already in place.
When you have the accomplishments that you have, like with all the letters that you can put after your name, how do you stay humble?
I mean, I don't know. I don't really think of it. It doesn't really.
You could blow your own trumpet easily.
Yeah, I'm not sure. I don't know, man. I think
but,
for me,
being someone that because people listening to this a podcast, the majority of people who are listening to this will have. They're being introduced to you now for the first time. Mm-hmm. Someone who has known you now over the course of, you know, probably a year now and seen you in bits, you don't ooze any arrogance. You don't use any kind of pride in your work, in what you do, and a lot of it, bro, is praiseworthy. Especially like being able to, like you said, go out there and actually change lives physically, bro. Like stitching people's faces back together and stuff.
Yeah.
There has to be a secret as to why you are so. It doesn't faze you, and you don't use this pride, and you don't just walk around with your chest held high. What is it that does that? Is it having kids?
I think having kids does definitely change your mentality and approach to life. It makes you think about things differently and what actually is important and what kind of your routine. Like before kids, you'd end up just sleeping in till like 9-10 o'clock, but now we're up at like 6. I'm up at like 5:30 in the morning at the gym now, knowing that I'll go then because I know the kids will be asleep, so when I go back home I can help them get ready, take them to school, etc. So just everything just changes, your whole like body clock. The biggest thing you'd think is like sleeping through, like I don't know, normally you go to bed at 12, wake up at 9, don't even have don't wake up once at all. When I'm like with kids, you're waking up every couple of hours. So it's amazing how your body adapts. Like I'd never experienced that or expected to experience that, but your body can just hack it. Like classic example today. So yesterday, got up at like 5, went to the gym for a couple of hours, got to work 8:15, got back home.
That was this morning, wasn't it?
No, that was yesterday.
Okay.
That was yesterday as well. So 2 days I've been doing craziness.
Whoa.
So basically, Wednesday morning, I was up at like 5, hit the gym for an hour, got back home, got to work for 8:15, Central London. Was there till 7, got home, 8, had all of my admin to do from the day because I hadn't done all the notes.
What does admin include?
So basically like clinical notes, like when you're writing up, like you've got to write all of your notes and everything like that within a certain time frame to make sure that everything's credible.
Who polices that? Why does it have to be done?
No one polices it, but it's good clinical practice to actually have your notes done on the same day so nothing gets forgotten, so that you have all of the treatment plans, everything organized for your patients. It's a legal requirement to have a clinical documentation of what you've done and said with the patients and things like that. Wow. So I had to do that the same day. So by the time I got to bed, it was 1:30, okay? And AM.
This morning now.
Yeah. Yeah, basically. And then I had my personal trainer at 6.
Wow.
So I slept like maybe 2-3 hours because Ryan was waking up. Zachariah was not well. He's unwell at the moment as well. So trying to sleep there maybe 2-3 hours, hit the gym for an hour, start work at what?
How are you alive?
9.
Yeah.
Finish work at 7, and I'm chilling with you.
That's mad. And it's very late right now.
Yeah, what
the time right now is...
It's like 9. I don't know how I'm awake, but I think going back to like we were saying this before, is when I was at medical school, I was doing this all the time. Like I was working a night shift because I had to earn some sort of money during that time because otherwise I'd have no income. And I was studying full time, 3 years. So I would do a night shift from like 8 a.m. at King's College. Sorry, 9 o'clock at night I'd start. King's College Hospital, it's like a level 1 trauma unit, so constant barrage of stabbings, dental abscesses, broken jaws.
But you was just dealing with things that happen on the face, right?
Yeah.
Okay.
So
are you a face surgeon?
So that's what I was training to be, and that's what I was classified as a senior house officer in oral and maxillofacial surgery. So what I'd be dealing with is like if I start at 9 o'clock, get a bleep taken over, I'd hand over all the ward patients. I'll be looking after ward patients from the day who've had surgery in the day, who've been admitted during the day with a broken jaw, with a dental abscess, or a stabbing or something like that. And then I deal with A&E patients rolling through the night. So if somebody would come in, car accident, someone would come in with a stab wound, someone came in drunk and they've fallen over, someone had the tooth knocked out, stick it back in, put it together, they go and see the dentist the next day. That's the sort of stuff that I would be seeing up until 8 a.m. And at that point, I'll be off to medical school to study, or to learn.
Wow.
And it's tiring, but it tests your limits as well. It sees where you can put, how much you can push yourself. So I'll be doing that on a regular basis. Even weekends, I'd be working sort of 48-hour shifts. Like you'd be working 8 to 8, go home, eat, sleep, and then wake up and do it again the next day.
There's a rumor that surgeons, to be able to have that laser focus,
it's caffeine, man.
Is it?
That's why you can see this
Is there
cup of
any-
coffee has been.
But is there anything else?
What do you mean, man? I don't know what you're talking about.
When we were at uni, there was a little study drug going around
Oh, okay. No, I mean
that would keep you awake to be able to focus on your revision and dissertation. It would make you go to
I know what you
toilet a
mean.
lot,
I know what you mean.
do you not need that to keep yourself going in
No,
surgery?
there was some rumors at my uni at dental school, and some people were using that. I can't remember the name of the drug, but there were some people were using that just to sort of stay focused and get their exams on, because it was intense, man.
Yeah.
Like dental school wasn't easy. So for me,
You've never needed to pop a quick pill and just
the
focus.
only thing I would ever take is caffeine. Like you just
Really?
coffee or Red Bull or something like that. I'd never really be on taking anything more than that. That was just, I don't know. It just never really crossed my mind. I
You
don't
need
know.
to try one of these pills. You'll be stitching out much more people cases, bro.
I'll be zooming through.
Yeah. Oh man, do you know what? It's so interesting having you on the podcast, Riz, because growing up, first of all, you do see doctors as like the other side. Like you feel like you don't relate to them. So it's interesting being able to pick the brain of one. And secondly, the reason it's interesting having you on my podcast is because I normally, with my co-host Sam, we normally discuss like books that we've been reading and stuff like that. And I'm always really interested in my degree in criminology. There was a part of it which was social psychology, so understanding human behavior. So I'm super intrigued by human behavior. And more so now because the books that I'm reading are always about human behavior, habit forming and stuff. I'm actually reading a book right now by a guy called Brian Christian. It's called Algorithms to Live By. And the book is so interesting because what it does is it's basically saying that computers have all these algorithms where they make that in which they make decisions based on probability and stuff, right? So there's algorithms that you can use that are like how computers use algorithms to like live your life. If, for example, if you ever have that problem of you're driving somewhere and you found a parking spot, but the place is about still like a minute away. Is it worth taking the risk and trying to see if there's a parking spot sooner? Or when should you stop and be like, I'm going to quit while I'm ahead? There's algorithms that tell you the probability mathematically as like what the best thing is to do in those situations. So that's the book that I'm currently reading. But my point is that I'm so intrigued by human behavior and understanding. So I've always wanted to pick the brain of someone who is like, you could write a book, bro. You could, bro, though, because
Don't know about that, man.
I'm intrigued as to, you have to be an elite level thinker to go through something as hardcore as dental school, come out and say, I want to go through medicine. Come out and then say, I want to do a master's. Come out and then be somewhere where a lot of people desire to be. To have your own clinic, not have one of your own clinics, but have 3 of your own clinics, more expanding, being someone who, alhamdulillah, you have customer, what do you call them? Clients, customers?
Patients. Clients,
you have patients coming in and out, whereas a lot of people are often kind of trying to get patients. At that stage of your life, and you're so young, bro. You're
32,
like,
man. I don't feel young, bro.
32 is so young. So at 32, being able to have accomplished all of that, and being at the stage now where a lot of dentists are only get to when they're 40, 45. At the level where they're at the top of a dental clinic, and they constantly got patients coming out. Why you would then go, I want to do another 4 years of studying so that I don't even understand what it is. What is it called?
So basically, it's
say it slowly though.
Prosthodontics. Okay. So basically, there's a specialty in dentistry. There's different specialties. Okay.
Fine.
So you have someone who's a specialist in gum disease management.
Right.
There's someone who's a specialist in root canal treatment. You get someone who's a specialist in prosthodontics who does sort of crowns, bridges, implants, full mouth rehabilitation, basically. So that's what a prosthodontist does. Because of my training in implant dentistry, I did that for 2 years at the Eastman Dental Hospital. I sort of came around to understanding dentistry on another level, and there was gaps in my knowledge that I don't think I'd be able to fully practice and perform dentistry to the level that the private clinics we have desire. And I want to be able to provide the highest level of care, and I think undertaking that training will give me that. And look, it's long, arduous, but I know and I see the work that the guys who are prosthodontists and the guys that I look up to and the work they do is amazing. So for me, I want to be at that elite level as an individual clinician to provide my patients the best quality care. On a personal level, I feel that I want to strive in whatever I do to be at the top of my game and be a specialist. Whether that was me becoming an oral and maxillofacial surgeon, a specialist in that field, whether this is prosthodontics, which is the field I'm going to become planning to become a specialist in now. So for me, it's about providing high quality care and just having that accolade as a higher level of training and ability.
But then where does it stop? Because you obviously have the mentality that you want to be the best, the very best at whatever it is that you choose to do.
Yeah.
But at what point will you be satisfied?
This will be the last point. I'm not going to do any more training.
Okay.
Man. There's no more I can do after this, man. It's like when you have a computer game and you've got like on Grand Theft Auto, you complete it to 100%.
Okay, you've completed.
Yeah, I've pretty much completed to 100. Well, not 100%, but you know what I mean. It's like there's only so much more you can do, and I think sometimes if you keep doing so many things, you never get good at one thing. So I think for me now, I've got that surgical background and experience from doing the maxillofacial surgery. I've got the dental degree combined with my implant training, and then this is like the final jigsaw.
You're a madman.
That's the that's the final piece of the puzzle to complete that sort of complete clinical practitioner that I think I should be.
It is good though, because it reminds me of that picture that says a good leader leads from the back. Is it something like, basically, to be a good leader? Because you're obviously having your clinics. You're obviously leading some of the other dentists.
Yeah.
But by being someone who's constantly learning and educating himself and saying, I need to improve, that's a very good standing as a leader. Like, you're obviously being a role model and you're not being satisfied with where you are. So I'm sure people who are beneath you are kind of taking that in as well.
Yeah, I think, when it comes to my clinical team, I don't really see anyone as beneath me. To me, if I get my colleagues busy and they get me busy, we all win. That's the way my approach is. I never look at, I'm going to take all the patients and I'm going to have a really long waiting list, and then my other colleagues don't see the patients. For me, if my colleagues see patients and everyone wins, it's a win-win. That's the way I look at it and approach it. So everyone's happy. That's always my approach to any, business deal or whatever. Everyone should win. It should be fair. And I think that, to me, is both Zeba and I's mentality that, if we get our colleagues busy, they will bring goodwill to the business, and then we can get busy as well. So everyone gets what they want, basically, and that's our approach to the business. And we see it as a team. We see the colleagues are on our level. All of these dentists are older than us, and in all honesty, they're more experienced than us because of the years that they've done. But I never look at my team as sort of beneath me in that sense. I think they're all my colleagues. I really enjoy the team that we have, and I think I was joking with Zeba about it. It's like we're trying to handpick the best dentist to work with and who've got the same ethos and vision that we have. Like, we've got Dr. McLean. He's one of the most accomplished composite veneer dentists. Just composite veneers, he does everything. He's one of the most accomplished cosmetic dentists. We've got Slaney as well, who started with us for a few years ago, and she's doing great. She's building her own brand and profile very well. And we've got other colleagues that we're working with as well who are up and coming. So for me, it's like having a good team basically is the key. That's the key thing. I always look back whenever I see I used to play Championship Manager a lot when I was a kid.
Oh, really?
Yeah, I was big on Championship Manager. I used to love Championship Manager. I'll be obsessed. I'll be there on my summer holidays. I'll be there at 8 a.m. literally, just smashing out season after season, winning everything. And to me, I always relate life back to football.
Did you have the CD version?
Yeah.
CD into your computer, yeah.
And the CD will get scratched and then you
How
can't play.
weird is that?
I know, it's crazy, isn't it?
Never now, it's impossible.
Can you even have CDs even available now?
No, I don't think you can put CDs in laptops anymore. But imagine a kid getting a CD, putting it in his laptop and playing Championship Manager. Waiting for it to load up.
That was me. Yeah. The loading was so slow as well. I had a rubbish computer.
I
had a rubbish computer when I was a kid as well.
I never understood Championship Manager. I'll tell you why. Because you don't ever
physically
watch a
play.
game.
Yeah.
You're just managing the team and you see who wins and loses. It's so annoying.
But I think that mentality, I am still and always have been obsessed with football. I've been a big football guy. I play football regularly. I watch football. I watch every United game pretty much. So for me, football is a big part of my life. And when I was growing up, I used to love Championship Manager. I'd sit there with my friends, and you're reading a screen and just flashing stuff. Yeah, it sounds stupid,
Do you know what?
but it's so addictive when
Yeah.
you get good at it. That's the thing. And I think for me, I remember that feeling when I had, okay, we're gonna bring this guy into our team and make our team stronger, make our team better, and bring this guy in and make this amazing football team, just like Real Madrid, the Galacticos. That's what they're called. It's like for me, it's a bit like that. And I always look. Because when I grew up, Sir Alex Ferguson, he was the best manager. I grew up on the class of 92. That cohort of like United team that was all in the England squad. They were an amazing team that just used to demolish any team. And that was, to me, that's a big inspiration to me. Like no matter where you are, whatever's happening, you're losing in the 90th minute, you come back and you win. That, to me, instilled mentality. And that came from the manager, Sir Alex Ferguson. So whenever I have approaches to anything, I always think back to that. I always think back to like Sir Alex Ferguson. What's the situation there? That because it was almost like he was a bit like a mentor without actually being a mentor. Does that make sense? Because he instilled a mentality into that team that you never quit and you never will lose. You just keep going until you achieve that goal.
It's so funny. I can imagine you in like your clinic right now, and like you're just facing a difficult task, and you're thinking, "What would Alex Ferguson do?" What would Alex Ferguson
seriously. Even I mentioned it to Zabe all the time. Like he was a big influence, and throughout like 20 years of like ever since I was a kid, he was the manager of United. So I'd see him every week, like talking about the game, talking about football, and and how well he managed a teams, cycles of teams over and over again. Because football career is a very short career, so he'd manage a team cycle over and over and over again, and it was just like it's amazing to see how he did that and maintain that level of his success. And that's the inspiration that I draw when me and Zeba, I always bring it back to football with Zeba, like having.
That must annoy her so much.
But no, she's understanding it now.
Oh, really?
She understands it now.
Does she understand the offside rule?
No, I don't know.
Really?
I don't know actually. She understands offside rule. I haven't really asked her about that, to be honest with you. But no,
You should definitely ask her.
I'll ask her later tonight.
Is
When
she
I see her.
asleep?
I don't know. She was messaging me just now. I don't know where she is. I think she's at home with the kids. But
You should get on the phone and ask her. She understands the offside rule.
but in terms of like mentality, man, that's where I drew inspiration from. And playing Championship Manager, building an awesome team was something that I really got a buzz of. And it's the same now. Like, having like really good colleagues who do lots of different cool, aspects of dentistry. Like I've got a colleague, Dr. Pete. On Mondays and Wednesdays, I work in the opposite room to him. And we're constantly in each other's rooms, sort of like saying, "Oh, what would you do here? What would you do here?" Like, it's nice to have colleagues that you can have that conversation with.
He was the first person to check my teeth. Not
Was
ever,
he?
but in your clinic, yeah.
I hope not ever.
Nah, imagine that. 25 years old.
And I think, like, for me, I just really enjoy working with, like, even, we're always in each other's rooms talking about, even today, I had a patient that I referred to my colleague Augusto today, just to have some, routine fillings done. But it's all about just, working in a good team, and that's what we're trying to develop and harness. And it's not easy. It's you go through a lot of mental hardship with staff and working with a lot of staff turnover, people not being happy, trying to keep everyone happy. And I really struggle with that personally, and Zeba is great at that, and that's I think why we work well. I focus on the clinical aspect of it. I enjoy working with people and working with patients. I really get a buzz of that. Whereas Zeba gets a buzz of, the vision, the brand, building.
And you can see that clearly. I think it's good to see that you guys have that balance. I remember when we first started working with you guys, Omar was saying to me how amazing it is that you and Zeba are clearly, the partnership works so great because you guys clearly understand what you're both passionate about.
Yeah.
I think Zeba told us before, she said, Riz is so in love with the clinical side of things. That's all he just wants to do. Like he doesn't want to have to deal with other stuff. And she really enjoys the other stuff. So
I mean, I don't think it's that I don't want to deal with this stuff. Like I just sometimes just struggle how to manage things. Like if you've got two people just arguing about something, I find it really hard to be in that circumstance.
It's not how you find that hard, but you don't find hard like the sucking face.
I'd
and-
happily stitch someone's face back together than deal with two people having a go at each other about something really minuscule. Personally, I much prefer doing that. Honestly, I don't know. It's just maybe it's just the way I'm wired.
yeah. Obviously, it's definitely the way you're wired.
And Zeba is like very good at mediating and talking to people
Yeah.
and her communication skills. And I think that comes from her own background, parents, and her father and uncle again are a great inspiration to me. They came to this country with very little, and they were able to achieve a lot of success in a relatively short space of time. So, there's a lot of inspiration I draw from them, from Zeba as well, and I can see that passion and drive in her. It really is there, and she's very passionate about the brand, and that pushes me, and I push her. So we just keep pushing and pushing, and yeah, we're 32, but I just think we still got so much more to give, man.
Well, 32 is really young. Bro.
Yeah.
Don't say like that. Don't say like, oh yeah, we are 32 now, I guess, but we still think we got a bit left in the tank.
No,
you got a lot left in the tank,
honestly,
bro.
man.
Inshallah.
Yeah, that's what I'm saying, man. I'm super excited to start this training program. For me, it's the next step, and I'm really sort of taking the clinical side of things, hopefully to another level. Inshallah, that's the plan.
Well, one thing that you've just started is, well, you've opened up a Twitter page, and secondly,
Someone told me to. I don't know who it was. Some guy.
and then secondly, you're like a bit more active on your Instagram now.
Yeah.
And I know that one of the key reasons for those things is that you genuinely want to help the next generation of dentists.
Yeah.
Does that same passion of wanting to help the next generation of dentists come from the same space that your need to help people comes from?
Definitely. I was literally going to say that. I think for me, it's just about helping people. I think if you help people, that's what it's about for me. It's always been like that, whether it's dentistry, medicine. I enjoy teaching students, that's something I really enjoyed. I was teaching while I was at medical school about oral and maxillofacial surgery because I had a certain number of years of experience in it, and I could teach the basics of it there was a surgical science bachelor's degree, and a couple of times a year I'd go and give lectures on oral and maxillofacial surgery. So I really enjoyed that, actually. I enjoy teaching. I enjoyed teaching my junior colleagues when I was a registrar working at Barnet Hospital. All of these things I really take pride in, and it's all about helping people whatever way you can. At the end of the day, if you can amass any amount of money, nothing's going to give you that satisfaction that you've actually helped someone. It's not about like trying to amass as many clinics as possible, trying to build the most valuable brand and things like that. It's all about trying to help people at the end of the day, and to me, that's what's most important. I think the key to staying humble is if you're naturally like that, you kind of just stay like that because that's just the way you think. So because it's the way I think, I'm humble in a way, if that makes sense. I don't know. I'm not sure if that.
I think if anybody is listening to this and they're either studying dentistry or medicine, or they're like a young dentist or a young medic, especially a medic in face surgery, they should take advantage of messaging you right now on your socials, on Instagram and stuff, because I have a feeling that right now, while you're young on socials and you just started out, you're going to be replying to these people and stuff, but I think very soon it's going to become overwhelming for you. You're not going to be able to answer all of them anyway. So take advantage now.
Look, I'm more than happy to sort of help out whoever I can. I've always just been like that as a person, really, and just trying to help people in any way. And I think students in medicine and dentistry, I can relate to both because I've done both of the degrees. I've done a master's in experimental oral pathology. I did that in the middle of medical school. So lab-based research. I was in a lab, those pipettes and taking out cancer stem cells and running experiments on them and things like that. So I've done all sorts up until this point. So I'm sure I can help. I'm more than happy to help as many people as I possibly can, in that way.
So outside of education and work, you mentioned that you got your two boys, Ryan and Zakaria. What is life like for you when you shut off work and you shut off things? So you mentioned that you're into football. How much time do you get to enjoy non-work life?
I'm not gonna lie, it's hard.
Do you guys go on holidays and stuff?
Yeah, we go now and then. I think it's difficult when you've got your own business because a lot of people, especially a young business, we've only been open for like a year or two, realistically. And for us, it's hard to leave without, you know, having an impact, because we're always needed. Everyone's always in touch with us, asking us questions, and, you know, needing to know things. And, you know, for us, we really struggle to just switch off, if I'm honest with you. I'm just being brutally honest, even because me and Zeba work together, so we're not always together. So one day I'll be in one clinic, one day she'll be in a clinic. So at the end of the day, we end up talking about, okay, how's your day? How's everything there? We just have like a catch up at the end of the day about work, and then we end up just talking about work, because by the time we've got home, maybe it's like 7, 8 o'clock, and, you know, we just put the kids to sleep, and we just like to have a catch up basically at the end of the day. And, you know, before we know it, it's like 9, 10 o'clock, we'd chill for a bit, go sleep. You know, that's because you're working together, we kind of have to communicate about work, because it's like we have the same team.
But you know what? The cool thing is that, like you said, a lot of the time you're in different clinics.
Yeah.
And also you're working on such different things.
Yeah.
Whereas me and my wife were watching this program the other day, and it was a husband and wife couple, and they were saying, we go to work together.
Yeah.
We work together. We come home from work together, and we and they were saying, like, they basically do everything together. And you think to yourself, like, that must be tough for them, because they don't have anything to catch up on.
Yeah,
they
it's true.
They don't
Yeah,
get
it's
to not
true.
see each other, so they can't.
Yeah,
each other.
I think
so
that's
it's good
true.
that it's nice that you guys can both do something they're passionate in, still work on the same goals. But like, there are lots of times where you guys are completely like away from each other, and you're in different clinics and stuff.
That's a good point, actually. If I'm honest, I've never really thought about it like that. It's actually good to not see each other for a bit, because then you
value that, right?
exactly. Then when you get together, you do have quality time. You know, for us, it's like getting time away is very difficult. But whenever we can on a weekend, it's just, you know, we're just spending time with the boys, to be honest with you. Like, that's, to me, I always think to myself, like, work is work, but, you know, you can have the most amazing, you know, composite veneer or, you know, Invisalign case, but at the end of the day, you know, you're never gonna regret wasting time with your child, watching them grow up and spending like a couple of hours with them. Like, a 3-year-old is amazing, because you can have conversations with him about the most random things. Like, it's actually really funny, the stuff that he comes out with. Like, he just starts talking randomly and goes off on a tangent about some other weird stuff. So, you know, I really enjoy spending time with him. So for me,
which one's the 3-year-old?
Rayan's 3 years old at the moment. So he's starting school now as well in September. So he's going to another phase of life. And I think to myself, when I was at medical school, working all those hours, working crazy night shifts and stuff like that, and like I look back to what the photos and things like that, I think, wow, like, he's grown up so much. You should really make every second count with your children, because it never comes back. Whereas, you know, an Invisalign case or, you know, an implant, there will always be an implant to do, there will always be an Invisalign case to do, but that time with your child, you know, that memory that you made, you're always going to remember it, if that makes sense. There's some like I look through my phone on the photos, and there's some, and you just laugh them back to think, okay, that was the time when that happened. Like, there's pictures of Rayan falling asleep in the chair, doing the weirdest stuff. Like, his one picture Zeba showed me, he's fast asleep, knocked out completely, with like a toy horse in his mouth. It's just the funniest picture. You know, we got so many funny pictures and videos, and it helps you remember those good times as well, you know. So for me, it's always about trying to just make the most of it. Like, work is always going to be there, but you have to sometimes just step back a bit, because sometimes you can get wrapped up in work, man.
Yeah, you can.
It's so easily done. And for me, it's not easy to try and balance everything. That's why I wake up early, go to the gym in the morning, so that I know when everyone's going to be asleep, I'm not going to affect anyone's, you know, morning routine. I'm not going to not spend time with my kids, because everyone's going to be asleep. So that's why I go when they're asleep. I either go before or go after they're in bed, or go to play football with my mates or something like that. So I try and make the most of the time when they're asleep, so that when they're awake, I can be with them. That's what I try and do as much as I can, even though it's a struggle in itself.
Is it how is it like? Because obviously, even though Rayan's about to go into school now, for the first like 3 years of his life, his education has come from you guys, like reading to him, and how has that been like for the first time in your life, raising a being and like teaching him things that like you're teaching him the basics that he's never known.
Yeah, you know what, kids are like sponges. Honestly, man, they repeat. Like when you're an adult, when you're a parent, you're a role model all day, every day. So whatever you do, they will see and they'll copy you. So like, I was at a petrol station the other day, and Ryan picked up some sweets, and they were like, I think there was some sort of gelatin sweets. And I goes, Ryan, we're not allowed those sweets because they're not halal, because they've got animal gelatin in them. Obviously, I didn't explain the gelatin whole thing.
Yeah.
But I said, no, we can't have those. They're not halal. And he goes, oh, okay, Daddy, they're not halal. And then like, we were in like a shop, like a clothes shop, and I said, no, Ryan, their shoes aren't good. And he's like, oh, Daddy, like, is it not halal? Like, it's shoes, like, you know, they're so innocent the way they're thinking.
Yeah.
And like, a while ago, like, I was having back problems. I think sort of maybe 2-3 months ago, and my son kept saying, Daddy, carry me down the stairs. I was like, Ryan, I can't, my back's hurting. And he said, Zeba asked him, okay, Ryan, let's do some handwriting and drawing skills, because we're trying to teach him to write his name and things like that.
Oh, wow.
So Zeba asked him, okay, Ryan, go and write the letter R, draw R. And he goes, no, Mummy, I can't, my back's hurting. Literally, kids do stuff like that. So you got to be careful what you say. You be careful what you say, because kids will do the craziest funny. It's kids stuff like that just cracks you up. It just makes you laugh. Like
it's funny because my sister, Saba, I call her Sabs, and
I've met Saba. I saw her.
Oh yeah, of course.
Yeah.
And when her little 2-year-old now, because he hears me call her Sabs, now he goes Sabs. It's so funny. So yeah, they do think of it.
It's true. Yeah, it's amazing. It's funny. It's just like, you know, they go through these funny phases. So, you know, fatherhood is a blessing. It's like, I reckon out of anything that I've done in my life, that's the hardest thing, having children.
Wow.
Like medicine, dentistry, it's the hardest thing. It's the toughest thing. But by far and above everything, it's the most rewarding thing as a human being. It's like, I liken it to, you know, when you were like 12, you go home and you're like, oh, I got this amazing PlayStation game, right? You'd be there, like, you look forward to going home to play that PlayStation game after school. You're like, oh yeah, I can't wait to go home. I can play this PlayStation game, play FIFA or whatever. And then you go to school the next day and you think, oh, I can't wait to go home and play that PlayStation game again. And the next day you think that. And then another game comes out and you think that as well. And that kind of same feeling is the same feeling you have with your child as well. And it's like that every day. You can't wait to go home and see what he's up to. How has his day been? You know, what's he been up to? That's how I liken it to. Because I remember feeling that way about, like, you know, GTA when it first came out.
Yeah.
The new. Did you play GTA when you were younger? Do you remember?
Yeah, I remember having a PSP, and like, because it came down to PSP as well.
Yeah. So when, like, you have computer games, like, I used to get super excited over it. And then it's the same sort of feeling, like, you just want to be home and see what they've been up to. You look forward to going home to seeing your children, your wife and your family.
Would you want your children to do dentistry, or are you not fussed what they do?
I mean, I don't know, man. I think
they have to live up to quite high standards.
I don't know, man. I think as long as they do something they enjoy, I've always had that mentality, is that just choose whatever you enjoy doing. And then if you enjoy what you do, you will generally be successful out of it. And if you're successful out of it, you'll be able to, you know, inshallah, have a good life from that, whatever that may be. So for me, obviously, I'd like them to do that, because we're setting up something hopefully special for the years to come. And it would be, I'd more love for my son to be, you know, someone I can teach, not just to become a good man, but to become, you know, as a career. I'd love to be his mentor in dentistry, and I'd love to do that, or medicine, or whatever he wants to do. I'd love for that to happen, because, you know, it's nice to have a legacy, and then you can leave that behind for them. And then, you know, it's like something that you can leave behind, because that's what it comes down to, isn't it? You can't take everything with you. You know, you want to build something so that your children can benefit from that, and then their children can benefit from that. You know, that's the way I like to think.
Yeah, it's super interesting, because sometimes children grow up and they like want to do the opposite of what their parents have done, because they've been around it. But then other times, like, they want to live their parents' legacy through, and they see the passion in it as well. Yeah, it'll be interesting over the years to come to see kind of what they decide that they want to do.
It's true.
So it's cool that you're kind of the kind of parent that's like, look, whatever you're passionate about.
Yeah. I think, I would personally love for it to be that, you know, one day. I say it to the girls that we work with now, like, you know, when Rayan sometimes comes into the clinic world, it's like, you never know, in like 20, 25 years time, it could be your boss, like, you know, in that sort of way. So, you know, you never know. And I'd love for that to be the case, you know, that I've built something up so I can hand it down to my sons. I would love for that to be the case. But in reality, you don't know what the future holds, man. That's the exciting thing about life. You know, you don't know what the next step is. You know, I never thought in a million years that me at the age of 21, 22, wanting to do like medicine would be at this point now. There was a point in time.
I'm freshly grounded. You made it.
That's what I'm saying, man. I feel like this is the point in my life where I'm at my peak right now.
Impression interviews now.
Yeah. But for me, it's like I would never in a million years thought I would be in a situation where I was after dental school. I went into VT, which is Foundation Dental Training, and I really just didn't enjoy it. I actually hated dentistry. I was like, I really just dislike it. I just don't enjoy anything about dentistry, and I'll do anything to be working in hospital because I enjoyed the environment. I enjoyed the camaraderie between the team. I enjoyed working in like a big group of teams trying to help people. That's what I really enjoyed. And I never thought I'd be in a situation where I'm now like completely opposite, going to do prosthodontics because that's like the highest level of dentistry. You know what I mean? So for me, it's just like you just don't know what the future holds. So to tell myself now that my sons want to become dentists and do whatever they want, they're so far off right now. So I just don't know. You know, you just never know. Just never know. Even like me being married with 2 kids, if you asked me that 10 years ago, I'd be like, what? You never think that you'd be in that situation, right?
True.
You know, life just unfolds like that.
Being that you are kind of primarily a dentist, it wouldn't be right for you to leave this podcast without kind of giving us like, and our listeners, some like go to dentistry or teeth tips and breaking some myths. First of all of these like things that you see on social media, like the light that people are putting on their teeth or the charcoal stuff, how much of that is a fad and how much of that actually works?
To be honest with you, I haven't really paid much attention to that light thing. I don't think it would be successful if people weren't promoting it, like they're getting to these big people to promote it. So you know, I really don't know how that works. I've not really looked into it, but I've seen this thing that they put in their mouth and they
like
put something like that. I don't know. I have no idea how that works. So one thing I would say is you have to be careful with that stuff because you don't know what concentration of bleach that's in there that can damage your teeth if you've got tooth decay. So if you've got decayed teeth and you're putting bleach in there, you may end up needing like root canals and stuff like that. So you need to just be careful what you do and just take the advice of a professional. You know, just go and see a dentist for a checkup and they'll tell you exactly what's what. So I'd be very cautious about using things that have been bought off the internet to sort your teeth out. Because I see some horror stories, honestly. Like I've seen patients put these snap-on veneers that you can buy off the internet and you just click them onto your teeth. And it's like I've had to take people's teeth out because of that.
Wow.
Because it's just messed the whole mouth up, you know?
One of the funniest things is when you see like adverts for like Colgate or Sensodyne and stuff, and then they film it in a way like the camera is a bit tilted, it's like a bad quality camera, and they film it as if like the dentist doesn't actually know that the camera's on. She's like, I recommend Sensodyne to all of my patients. Have you ever looked at those adverts and thought, oh my gosh, like are they even real dentists? Probably. No,
the ones that they use on the Sensodyne adverts are real dentists. They are real dentists, but they film it in some studio. It's not really a dental clinic,
okay.
so it's not biased to a clinic. That's I think they have to be fair. So I don't know. I mean, Sensodyne's a good toothpaste, but I'm not sort of going to say one's better than the other. I think whatever works for you, as long as the toothpaste has fluoride in it, I would say use whatever toothpaste you can.
Okay, talk to me about a manual toothbrush versus electric toothbrush. And the reason I say that is because since I started being seen at Rüh, I've switched to an oral toothbrush. They are all oral toothbrushes. I switched to a electric toothbrush, and I was taught how to use one properly. And it's changed my life. So why?
Gums are looking good, man.
Thanks. Well, they weren't the other day. Why is it so important to use an electric toothbrush as opposed to a manual one?
I mean, the thing is, it all comes down to technique. Okay, if your technique is very good with a manual toothbrush, might be even more effective than an electric toothbrush. An electric toothbrush basically negates that need for a good technique because it does the vibration and removes the plaque through vibration and automation of the actual bristle movement. So to be honest with you, it just removes the need to have to brush in a circular motion at a certain angle, etc., etc. So that's why it's better. I personally use electric toothbrush as well, and I prefer that. I find it much cleaner. Some people don't. Some people prefer manual, so it's each their own.
And when you use a electric toothbrush, you have to instead of like brushing, you have to
Yeah.
just hold the
Yeah,
toothbrush on
yeah,
each
yeah.
tooth for like
Exactly.
10 seconds at a time, right?
Exactly. Yeah.
Yeah.
We say 2 minutes in total, so 30 seconds plus per quadrant, and not too long, because again, you can end up rubbing your gums away, wearing your gums away if you brush for too long a period of time.
Yeah, I have the toothbrush that was recommended by you guys, and it's really effective, man. And the hygienist at the surgery told me to use the smaller
Brush
because my teeth are smaller or something.
Yeah, if the gaps between your teeth are smaller, which
Yeah.
they tend to be if you're not, if your teeth are quite, next to each other, if they're quite aligned, then yeah, they you probably need a smaller one.
So because you guys do like all different types of like alignment and stuff as well. Being that you offer braces and then you offer incognito braces and you offer what's that other one called?
Invisalign.
Invisalign.
Yeah.
Do you have to always be biased? Like what generally is the best way to straighten teeth, or do they work for different things?
I think the way I explain it to patients, because it's a very common question actually when patients come in and go, what's the best treatment option? The different options are tools, okay, to get an outcome. So Invisalign is a tool to get a result, and I feel personally that's the system I use personally to get a good result. I've done extra high level training with Invisalign. I'm doing a diploma in clear aligner therapy at the moment. So for me,
you just done too much education. You need to slow down.
I know. I guess it's true, man. I need to calm down, I guess. But for me, Invisalign, I'm confident of getting a good result with that. Whereas other people prefer certain cases to be done with fixed braces or incognito. Now, incognito is a brace system which goes on the inside of the teeth. Okay, it's made of a gold alloy, and it said that it's a lot quicker than Invisalign in some cases, and that's because of the way the tooth movement is and mechanical engineering of the way the brackets attach to the teeth. So without going into too much detail and technology, that's how it works. And we've got someone who does incognito, one of the world's #1 providers of incognito, working with us, Dr. Stefan Decker. So we always refer to him for fixed braces and incognito braces, but there's no right or wrong answer. It's just a tool to get you to the way where you want the teeth to be in at the end. I just prefer Invisalign because I've been trained in it. I know how to use it. I know how to get a good result with it. Whereas Stefan Decker has done a master's in lingual braces, so he's got a high level of training in that field, which is why he doesn't do Invisalign, but he does that. So everyone is each to their own, really, and it's a tool. It's just a tool to get to a certain outcome.
I remember when I was studying at university and we were living with some dentists, and one of the dentists, he said to me, we were in a group, and he said, did you know that it's better if you're going to eat, it's better for you to eat a whole tub of ice cream at once than to eat it in bits throughout the week.
Yeah.
And I didn't realize he was speaking about your teeth.
Yeah.
And I thought he was just speaking about generally in health, like that you won't get as fat if you eat a whole tub of ice cream at once.
No.
I used to for years, yeah. Like let's say for example, if me or Mrs. are chilling and we like get some Ben and Jerry's, like, and she'd eat half the tub.
Yeah.
I'd be like, oh, I'll save it for tomorrow. I'll be like, it's actually better for you if you just finish it off now. And so, but I was doing this for years.
So you basically got fat but had good teeth.
Right. And then, only until I went to Rüh Dental.
No.
Yeah.
Are you actually kidding
did
me?
I hear
Seriously?
the same thing being said. And I put two and two together. I said, hold on, that guy was studying dentistry. These guys dentists. Maybe they're talking about teeth and not about... And I realised that it's because... If you're gonna put sugar in your mouth, you might as well just do it once and for all, and then brush after, and then it's better than throughout the day damaging your teeth with sugar.
Basically, yeah, it's frequency over like quantity. So if you have a whole bag of sweets in one go, that is actually better for your teeth than having the same bag of sweets throughout the whole day.
Yeah,
if that makes sense.
But
yeah.
not for your
for your health.
No,
yeah, I wouldn't recommend having a bag of sweets in one go either, or either just having sweets in general, because I'm a dentist. I've got to say that.
Yeah. Do you get a lot of people, like family and friends, constantly asking you questions about their teeth? You must do.
Not really, to be honest with you. Not really.
Oh,
I
really?
mean, when I see family, we just catch up about family stuff. When I see friends, it's just about
Football.
general stuff, really. I don't really, we don't really talk about teeth as much Now and then maybe, but not all the time. No, noticed.
What's it like getting 20% off at Nando's?
20%.
Oh, you didn't know about this?
No, what 20%?
Bro.
The NHS thing.
Yeah.
No, it doesn't work
Anymore?
No, they've changed it to like £5 or something off the top bill.
really?
It used to be that. I used to
Yeah,
make
'cause
the
when
most of
when I
it.
was at uni, we
Yeah.
used to always.
Yeah.
When we were at uni, we used to, cause we, like I said, we lived with medics, and so we used to always get discounts
Yeah,
at Nando's and
yeah.
stuff.
That
Also,
Nando's discount was amazing. That
Yeah,
was sick.
you
That
get 20%
Nando's
off.
discount. Yeah.
oh,
That
so
was
you
amazing.
don't get that anymore?
No, it's like you get like £5 or £10 off the
Oh.
whole bill. So they just give you a £5 or £10 discount. They don't give you that 20% because they're probably realizing how much money they're losing
Yeah.
by working or having a Nando's near a hospital because
Yeah.
everyone would just come in for an NHS discount.
So do you guys do doctors get what other perks do you get?
I mean, I don't know. The dentists of old, they used to tell me you used to get like free haircuts and free car wash, and I don't think people have the same level of like
Love.
love and respect. I think for the profession anymore. I don't know. Where it's just the world has changed a bit.
Do you get anything by being a doctor?
Not really. I mean, you get the NHS discount, I guess. I mean, I don't get that anymore because I don't really work in NHS anymore. Like at Apple, you get like is it NHS discount you get at Apple? I'm pretty sure you do get an NHS discount or some sort
The
of
NHS
discount.
discount at Apple is very small.
Yeah, it's very small. That's
Yeah.
maybe something that I've got. But apart from that, nothing really.
Does it feel cool when you first became a doctor? Did it feel cool when you had to fill out a form instead of
No,
clicking?
yeah,
ticking
everyone
next to it, you
gets
just click
super
next
excited and gassed over having to put doctor.
Doctor.
Yeah. But it's just
to
like
it. Now do you just put Mister?
I
No,
don't
you used to
even
put
know.
doctor.
I don't actually know. Do I put Mister or do I put doctor? I don't know, it depends on the form. It depends. If it's a parking fine, I'm hoping that they'll like accept my reject appeal.
If
I
you say
put
doctor Riz.
but it never works.
Oh, really?
Never works.
Do you get angry at fake doctors like Dr. Dre? Yeah. You're not a real doctor.
No.
I studied dentistry and medicine to be called this. Do you not get like a doctor squared for studying having two doctorates?
I don't know, man. I'm not sure if that's a thing, really. But no, I mean, no, I don't know. The whole doctor title, it's cool for the first like year or two, but you kind of just get over it after a while. To be honest with you, it's
Yeah.
cool when you're young and like you just qualified. Everyone's like, calling each other doctor this, doctor that, and you're like, yeah, that's fun. But now it's just like, it's just a thing, isn't it?
You do have a really doctor voice though. Like
Really?
not now as we're speaking, but I've heard your doctor voice.
Do I have a
Yeah,
doctor
you do
voice?
have a
Do I?
It's like super professional.
Really?
Like because I remember like last year when I was doing some of the videos, and you're like when you're speaking to a patient, you have such a trusting voice when you're speaking to patients. Like you'll sit down with them and you're like,
Do you not trust me right now?
no, I do. You still sound a bit like a doctor, but now you're a bit more relaxed. But
Yeah.
when you're chatting to a patient, you're like, so what it is when you've got the at the back of your teeth, you have, and you just like you become like so doctor is one. It's so
Yeah.
funny, but it's very like. It's uber professional. It's how you want your doctor to sound. I can
Yeah.
imagine you walking around the woods and like being really doctory. Like you hold that professionalism very well. Is it something that you take seriously? And you make sure that you
I think like
just
with-
being a professional.
I
Basically.
think dentistry medicine, it's really a profession of communication. I think that's the biggest thing that I've learned over the last like 5 to 10 years of practicing, actually seeing patients in real life, is to communicate with people. It's really important that you're able to do that. And a lot of people have seen bad communication and the outcome of that. And that's why I always think to myself, you need to really communicate with people. So whenever I see a patient, maybe there's a bit of an element of I don't put on a doctor's voice, but I want to come across as professional and that I know what I'm talking about. Not that I don't know what I'm talking about, but I want to sort of have a certain level of professionalism in the way I come across to people.
Of course.
So you can't just sit there, in your tracksuit, which I'd love to sit there and do, and just, have a chat like you're with your mates. You're in a zone where you're a professional. You're expected to be to a certain standard of how you communicate with people. And for me, that's really important. So always from a very early age, I think I learned most of my communication skills by working in retail. At the age of 16, I worked in Sainsbury's, I worked in Marks and Spencer, I worked in Next.
No way.
I worked in all like these retail outlets, and I think that really gave me another level of like interacting with people, clients and customers, and providing good customer service, because all of those places expected that of you.
Yeah.
So that you kind of ingrained that within me, and I think I take those experiences with me, and I take it into my day-to-day practice about how I communicate with patients. And I think it's so important to communicate with people and patients, and I think that's 90% of the job is communication. You know, shaking somebody's hand. You know, having a laugh with people. Like I really enjoy when I sit and talk to patients. I get to know them. You know, I enjoy like getting to meet them on a regular basis. I think that's the good thing about dentistry. You really get to know a person over the course of Invisalign treatment over 18 months. You get to see, oh, they're getting married, and you know, you get to see the change that you've had on these people. And when you show them like things like before and afters, and they're like, wow, I can't believe that, you know, that treatment has made me look like this. And it's quite rewarding to have that, and they have that trust in you, and that's quite a rewarding thing to be able to hold on to for me.
Riz, I want to say a huge thank you to you for joining us on the podcast.
Honestly, man,
you woke up at 1. You went to sleep at 1:30 this morning. You woke up
Yeah.
at 5. You went to the gym, and then you had a whole day of clinic.
and I've got
then
a whole day of clinic tomorrow morning.
you got a whole day of clinic tomorrow morning.
Starting at 8:30 as
Wow.
well.
And it's like, was it 10 o'clock at night now?
Yeah,
It must be
something like
past
man.
that.
Yeah.
So I appreciate you coming down. Like I said earlier, any young dentists or young medics or anyone starting out in the field or starting out studying,
or even people wanting to sort of get involved in the field.
Yeah.
I'm more than happy to help.
Riz is your go-to guy, and right now, while he, like I said, is young in the social media game, and you'd probably get a lot more of his attention. So do take advantage of that. And yeah, bro, I'm looking forward to kind of working with you more in the future, and hopefully you sorting out my gnashes as well.
Come through, man. Honestly, I'm more than happy to help you. More than happy to help you, man. Thanks a lot, man. Appreciate it, bro. Thanks, man.